My biggest short-term concern right now has to do with my staff. My biggest short-term concern right now has to do with how are they going to manage in the next several weeks. Governor DeWine in Ohio has shown an amazing degree of leadership and has been willing to make the really, really hard decisions that are necessary to keep his people safe. But the effects have been just dramatic on businesses like ours. Short term, we're shut down, and there's nothing special about my practice. There's nothing special about an ophthalmology practice or a medical practice. We're just another small business, like all the other small businesses that are privately owned. But today's the last day that my staff gets checks. We ran payroll, we had money in the till, and we're sending out paychecks. And my short-term concern is what's going to happen in 2 weeks, what's going to happen in 4 weeks if we can't get going. Those of you who are in medicine in any way who've had to make a payroll, those of you who are in private practice or were once upon a time in private practice know that there's a lag between when you do the work, when you send the bill in, and when you get the money. So even when we get back, there's not going to be any money coming in. Short term, I'm concerned about my people. Long term, it's really quite simple. Am I going to survive? Is my practice going to survive? Is my practice going to be able to stay open? Is my business going to be able to stay open? I think that for many years now, certainly since Mr. Obama's first term, when the Affordable Care Act was passed and incentives were placed in the system for a massive increase in the size of organizations, the so-called accountable care organizations. All of the incentives in the ACA were to get bigger, 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 bigger. And what that did was gobble up a huge portion of the private practices in the world. I think if my memory is correct, something on the order of 75 or 80% of ophthalmology practices, maybe more, in 2008 were private. And it's much, much less than half now, even if you include the groups that have become part of the big private equity swing. But the ACA didn't kill the private practice of ophthalmology. The ACA really thinned out the herd, if you will, in all types of medicine, but it didn't destroy private practice, and it didn't destroy the ability for small practices to survive and maybe even thrive. My long-term concern, without access to capital, without access to the ability to pay my staff, without access to to monies necessary to pay my rent, pay my my capital loans, feed myself. My long-term concern is that the private practice of medicine will go away. What the ACA wasn't able to accomplish, my concern is that COVID-19 will see the demise of private practice. We'll see the demise of the small, personal, hands-on touch practice of medicine across the board.